My name is Kamisha Harris. This is my Spring 2024 Head to Toe Assessment. So we will begin by inspecting the skin, including the head, face, and neck, anterior, posterior chest, as well as the abdomen, upper and lower extremities. Skin is warm, dry, and intact. No lesions, no scars, no nevi. Color is appropriate for ethnicity. Hold your arm up. No tinting with skin turgor. So then we will go forward by inspecting the scalp. The hair color is black, coarse, hair distribution is even, no tenderness, no masses, indentation, infestations, no scars noted. Then we will palpate the temporal arteries, no tenderness noted. We want to inspect the head, assuring that it's normal cephalic with shape and symmetry. Then we will palpate the lymph nodes of the head and neck, beginning with the preauricular, postauricular, occipital, tonsillar, submandibular, submental, anterior cervical, posterior cervical, and supraclavicular. Then we will palpate the TMJ for any subluxation, crepitus, or tenderness. And then we will begin our inspection of the face, starting with the ears. We want to inspect for symmetry and position. We want to palpate on both sides, the pinnae and tragus, looking for any tenderness and masses. Then we'll go ahead and grab our otoscope. And we will inspect the inner ear on both sides, looking at the tympanic membrane. No redness, swelling, or drainage noted. Then we will assess cranial nerve 8, which is the vestibulocochlear nerve. We're going to begin with the whisper test. So we'll have the patient to repeat after me.
1, 2, 3. 1, 2, 3.
Then we will assess with the Weber test, assessing for lateralization. So we'll grab our tuning fork. We're going to place it in the middle of the patient's forehead. Okay. And then we're going to assess with the Rene test. So we're going to place the tuning fork on the patient's mastoid bone on each side, assessing for air conduction being greater than bone conduction. Okay. So once we've assessed the ears, we'll go forward to assess the eyes. We're going to inspect the eyebrows, eyelashes, and palpebral fissure for any deformities. The hair is evenly distributed, no infestations noted. We're going to go ahead and inspect the eye, noting that the sclera is white. The conjunctiva is pink and moist, no drainage or lesions noted. And then we're going to assess for cranial nerve 2, which is the optic nerve. We're assessing for gross visual acuity and peripheral and central vision. So we will grab our Snellen chart. So we will have the patient to read off the lowest line.
LTFPH.
Okay, cover one eye and read the lowest line.
LTFPH.
Cover the other eye and read the lowest line.
LTFPH.
Okay. So then we'll go ahead and assess for peripheral vision. Let me know when you can no longer see the pin light.
No. No.
Okay. Then we'll assess for cranial nerve 3, which is the oculomotor nerve. We're going to assess for direct and consensual pupillary reaction. So we'll assess the eyes at the normal gaze. And then we'll bring across the pin light. also test for accommodation and convergence. So we'll have the patient to stare at the pen light and follow. Okay, pupils are equal and reactive to light and accommodation. Then we'll assess cranial nerves 3, 4, and 6, which are the oculomotor, trochlear, and abducens nerve. So we're going to assess for the conjugate gaze and have the patient follow the 6 cardinal gazes. So you're just going to follow the pen light for me. Okay. So then we'll assess for the red reflex. Okay, red reflex noted, along with other internal structures. So then we'll advance to the nose, making sure that it's midline and intact. We'll assess for cranial nerve 1, which is the olfactory nerve. So we will have the patient to occlude one nostril and close his eyes. With this nerve, we'll also be checking for patency. So you tell me what you smell.
Cough.
Okay, occlude the other nostril and tell me what you smell.
So sweet.
Okay. So you can open your eyes. We'll now palpate the frontal and maxillary sinuses for any pressure or tenderness. Okay. Okay, so then we'll go forward to the mouth. We're going to assess cranial nerve 5, which is trigeminal nerve. We'll have the patient to clench his teeth, assessing the masseter muscle, the motor response, and then you'll close your eyes and let me know when you feel this light touch.
Yes. 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 Yes.
Okay, open your eyes. Then we'll assess for cranial nerve 7, which is the facial nerve. We'll have the patient to smile, frown, raise your eyebrows, puff out your cheeks, pucker your lips. Okay, we'll go ahead and assess cranial nerve 9 and 10, which is the glossopharyngeal and vagus nerve. We'll have the patient to say ah.
Ah.
Okay, we'll assess the mouth. Note that the soft palate and the uvula both rise with phonation. Then we'll assess cranial nerve 12, which is the hypoglossal nerve. Have the patient lick out his tongue, move from side to side. Tongue is present, intact, with no fasciculation. The soft palate, buccal mucosa, the teeth are age appropriate. The palate is soft pink and intact. The salivary glands are intact. Underneath the tongue is pink, moist, and intact. The tonsils are intact. No swelling or redness noted. They are grade 2. Okay. And then we'll advance forward to the neck. So we want to be sure that the trachea is midline. Then we're going to ask the patient to swallow to assess the thyroid gland. Okay. Then we're going to palpate for the carotid artery. Okay, and then we'll listen to the carotid artery for any bruise. After we have inspected the throat, we'll move down to the posterior and anterior chest. So we'll inspect both for any deformities or skin issues, none noted. So then we're going to assess for signs of respiratory distress, such as nasal flare and cyanosis, tachypnea, retractions, accessory muscle use, a tripod positioning, none noted. So we'll have the patient to turn his back towards the camera. A little bit more. Okay, so we have already inspected the posterior area. So now we are going to Now we are going to percuss. We're going to percuss over the, no, we're going to palpate for chest expansion. So we have the patient breathe in and out. Okay, then we'll palpate for tactile firmness. So we'll have the patient say 99 with each tap.
99, 99, 99, 99.
Okay, so then we'll percuss over each intercostal space. And then we want to listen over each intercostal space, including the posterior and lateral lobe. Okay, you'll breathe out regular for me. Okay, now we're going to auscultate for egophony, which with each tap of the stethoscope, you'll elongate the letter E, such as E. Okay? You'll say E.
E. E. E. E. E. E. E. E.
Now we'll auscultate for bronchophony. With each tap of the stethoscope, you'll say 99 in a normal voice.
99, 99, 99, 99, 99, 99, 99, 99.
And now we'll auscultate for whisper pectoralipoi. With each tap of the stethoscope, you'll whisper 99.
99, 99, 99, 99, 99, 99, 99, 99.
Okay? So then we'll have the patient to turn around to the front to assess the anterior chest. Okay, so we've already inspected, no deformities were noted. So we're going to palpate for chest expansion. You'll breathe in and out. Okay, with each tap of my hand, you'll say 99.
99, 99, 99, 99.
Okay. And then we are going to auscultate the long sounds for the anterior chest. Now we're going to auscultate the cardiac. We're going to auscultate over the cardiac points, starting with the aortic and going forward, using the bell and the diaphragm. So we do aortic, pulmonic, Erb's point, tricuspid, and mitral, which is where you identify the PMI, and it's where you get your apical pulse at 60 seconds with your rate and rhythm. So now we'll identify those same sounds using the other side of the stethoscope. starting with aortic, pulmonic, earth point, tricuspid, and mitral. Okay. And then we will have the patient lay on the bed with the head elevated at 30 to 45 degrees. So we will then assess for jugular vein distension and pulsation. Scoot down just a little bit. Okay, then we would listen for any bruise. We would then inspect the chest area for any, we would then inspect for any heaves and lifts. And then we would palpate each cardiac point for any thrills. So we're going to palpate aortic, pulmonic, tricuspid, tricuspid, and mitral. Then we want to listen to those same cardiac points with both the bell and diaphragm. Aortic, pulmonic, tricuspid, and mitral. We switch over. Aortic, pulmonic, tricuspid, and mitral. We would then go ahead and begin inspecting the abdominal area for any contours or symmetry. The stomach is flat and undistended. So we want to go ahead and listen for any bruise at the aortic, renal, iliac, and femoral arteries. The aortic, renal, iliac, and femoral. After we listen for any bruise, we want to listen for the bowel sounds in all four quadrants. Quadrant 1. Then we're going to percuss over each area, noting any tympany, dullness, or resonance. And then we'll palpate for any tenderness or masses. None noted. Then we're going to palpate for both the spleen and the liver. So then we have the patient sit up, and we're going to percuss for CVA tenderness. So you'll just turn slightly this way so they can see your back. Hold your arm up. And you'll turn the other way so I can do the same thing. Okay. you sit up and get comfortable. Okay, after we inspect for CVA tenderness, then we will advance to the musculoskeletal system. So we'll go ahead and inspect the patient's hands. Inspect the patient's hands, wrists, elbows, and shoulders for crepitus, symmetry, nodules, redness, tenderness, swelling, none noted. So we'll go ahead and palpate for capillary refill on both sides. Less than 3 seconds, and then we want to go ahead and palpate the radial pulse, which is present. So then we will assess for range of motion with our fingers. So you want to hold your fingers up. You want to flex, extend, hyperextend, abduct, adduct, and thumb opposition. We'll go to our wrist. We'll flex, extend, hyperextend, radial deviation, ulnar deviation, and external rotation. Okay, we'll go to our elbows, relax. We're on the flex, extend, hyperextend. Then we'll go to our shoulders. We're going to flex, extend, hyperextend, internal rotation, external rotation, abduction, adduction. And yeah, okay. So after we've done our shoulders, then we're going to assess for strength. So we'll begin with your shoulders. You want to flex against, we're assessing cranial nerve 11, which is the accessory nerve. You want to push against resistance, flex with resistance against the shoulders. Okay? So then we're going to do your biceps and triceps. You hold both of them up. And when you're going to flex and extend. So you're going to flex against resistance. Okay? Extend against resistance. Okay? Then, okay. Then we're going to assess for your cerebral opposition, your cerebral coordination. So we're going to do serial opposition. That's just putting each finger against another one. Okay, so then you'll do hand flop really fast as you can. Then we'll do finger to finger, this hand. Okay, then you close your eyes. We're going to assess for stereognosis. So you'll keep your eyes closed. I'm going to place something in your hand, and you'll tell me what it is. Open both of your hands for me. Okay.
A little cone.
Okay. Keep your eyes closed. We'll assess for graphesthesia. So this time I'm going to write something in your hand. You'll just tell me what it is. It'll be a letter. So open your hands wide enough for me to write something in them.
O.
Okay.
L.
Okay. You can open your eyes. So then we're going to assess for vibration over your orbital malleolus. So you just hold your hands up for me. Radio, so turn it this way. Let me get here. Feel the vibration. Okay. Then we're going to assess for deep tendon reflex. Get my palette. Okay. Inspect it. Strength. Okay, so we're going to start with your brachioradialis on both arms. We'll be here. Hold your arms up for me. Okay. And we'll go to the next one. Then we're going to do your bicep. Then your tricep. Then we'll do your patella. Yeah. Okay. Relax it. Okay, then we'll do your Achilles. Relax your leg. Then we'll do the Bambisca reflex. Okay. So I've inspected your upper body. We've assessed for range of motion. We've assessed for strength. We did cerebral coordination. Okay. So then we'll go ahead and inspect your lower extremities. This includes the toes, the feet, the ankles, the knees, the hips. There are no deformities. Everything's symmetrical. No nodules, no redness, no swelling noted. We'll begin by assessing range of motion. So we're going to flex our toes, extend them, bring the toes apart, which is abduction. Bring them together. That's adduction. So then we're going to go to our ankles. We're going to flex them, extend them, hyperextend them. We're going to do inversion, eversion, then rotation. Okay? So we've inspected your range of motion. Now we're going to assess your strength. We're going to do your capillary refilling your toes. Less than three. We're going to palpate your pulse. Okay. And then we'll do the dorsalis pedis. Okay. Now I want you to, with your feet, forgot to say these, so we'll do dorsiflexion, that's bringing them up. With your feet, dorsiflex them, and then plantar flex. Now we're going to test your strength. So you will dorsiflex, okay, and then plantar flex, okay. So after that, you can stand, and we will do range of motion with our knees and hips. So we'll begin by flexing, extension, hyperextension. Okay, with our hips, we will flex. I'm sorry, I did it wrong. Flex, extend, hyperextend, abduction, adduction, inversion, eversion, circumduction. Okay, we'll do the same with this one. Flex, extend, hyperextend, abduction, adduction, inversion, eversion, circumduction. Okay, so we've assessed our knees as well as our hips. Now we're going to assess the strength. So I want you to flex with your knee, bring it up against resistance. Okay, you'll do the next one. Okay, then you're going to extend against resistance. Yep, same thing. Yep, now you're going to do the same thing with your hip, except you're just going to take it out. Okay. Okay, now try to bring it in. Okay. Same with this one. Okay, now AB duct, AD duct. Okay. So then you'll turn to the side and we'll assess for curvature of the spine. No scoliosis noted. Everything is symmetrical. So then we're going to work on range of motion for the lumbar spine. Okay. So we will flex, extend, hyperextend, lateral rotation, and rotation or circumduction. Okay, then we do our cervical spine. We'll flex, extend, hyperextend, lateral rotation, and complete rotation. Okay, then we'll turn to the front. We'll assess for Rumberg, so you will close your eyes and just stand for a couple of seconds. No swing noted. You'll take about 3 steps forward, 3 steps backwards. Tandem and gait are steady. Then you'll hop on 1 foot for me. No safety issues noted. And this concludes my head to toe assessment for spring 2024.